Welcome back to Great Day Washington. There are a lot of people who would like to cycle, like you saw in our last segment, and be more active, but they are limited in their activity because of chronic pain.
Our next guest says you don't have to live with that pain. Here now is Dr. M. Scott White, D.C. He is the president and founder of New Life Laser of Northern Virginia. Welcome back.
Excellent. Let's make him look a little more distinguished today.
We're going to dress
I'll wear that. Oh, that is hysterical.
Right. Do you need help putting this on?
I think I do.
I kind of figured you didn't know how to tie one, so
I don't think I do. Yeah.
Look at this. Now let's get into the first question. Now we dressed him up.
Yep.
We got to get rid of this back
There
pain.
you go.
Is that going to be
My
too
back
tight, Chris?
Oh, it feels fine.
Yeah,
what we did.
I've got a bigger neck than you apparently.
There you go.
We use a robotic deep tissue laser.
There you
now, the
go.
big deal about this laser, you do look good.
It looks good. Thank you, sir.
The big deal about this laser is it doesn't do any tissue destruction. There's no cutting. This laser is transdermal, but it's very powerful. So it goes through the skin, basically give us a bare area, whatever area we're treating, and the laser literally penetrates about 5 inches. It draws out inflammation, like doing a steroid shot or taking a pill, but no pills and no needles. So for pain reduction, it's amazing. We're able to reduce the inflammation, which results in decreased pain.
Right.
But more importantly, we're actually able to do something to fix the problem. You know, if you just keep taking pills and shots, you got to wonder, well, why do they keep coming back? It's because we're not eliminating the problem. So what the laser is able to do is speed up the metabolic activity of the cells, actually turn on the energy to the cells so that it can heal, put blood supply back in the area so that you're actually doing something to fix the problem, eliminate pain, but to actually fix the problem so that you can actually put yourself in a better position.
Brilliant.
So what types of conditions does this treat, your robotic laser?
Well, we can treat any musculoskeletal condition, anywhere that you're having pain except for the eyes. We always have to protect the eyes because eyes and lasers don't mix. But we see a lot of knee problems, hip problems, spinal problems, disc degeneration, spinal stenosis, arthritic problems, those sorts of things. Anywhere where you hurt, we can use this laser other than the eyes.
Arthritis too?
Yeah, and this is really what I want to talk about today. You know, people feel like once they have the A word,
right,
you know, there's nothing they can do, that they just have to live with it. It's just not true. You know, the drug companies would like us to believe that we just have to stay on medication. I have patients come in and they literally are taking, you know, ibuprofen 4 times a day just to function. What the robotic deep tissue laser does is it stops the progression of arthritic tendencies, puts blood supply back in the area so it can actually heal. Knees, hips, discs in the spine don't have a good blood supply. Once we reach the age of 6 to 8 years old, those areas just don't have a good blood supply. So if you cut yourself, for example, 3 days later, it's gone. It's because blood, it's magical. It's because blood gets to it, turns on the stem cells, and literally those tissues are able to heal. So the robotic deep tissue laser can put blood supply back in arthritic areas, no matter where it is, whether it's a shoulder, knee, joint, foot, doesn't matter, spine. Put the blood supply back in so the tissues can actually regenerate and heal. It's turning on stem cells.
Interesting. Now, what about people who have spinal disc fusions?
You know, so many times people will come in, patients will come in, and they feel like they're at the end of their rope. They're praying, God, what can I do? Because they've had surgery. And they feel like the only thing left is more surgery. Well, it's not true. You know, you haven't done everything until you try this robotic deep tissue laser. And the exciting thing about it is post-surgical cases, the laser, we can't take out the screws, we can't take out the plates, but what we can do is we can actually cause the tissue to heal around where the surgical procedure has been done. So, you know, don't feel like you have to have another surgery. Let's get you in, take a look, help you with this laser so that maybe you don't have to do another surgery. So post-surgical cases work really well generally with this treatment.
10 years ago, I saw David Copperfield. He used the exact same method you're using now. So see, we're using it right. That's not true. That's not.
I think there's lasers in it.
It feels like magic, I'm sure.
Right.
Yes. Do you have a special offer you'd like to share with us?
Yes, actually, what I want to tell the folks is this. The beautiful lady is going to read that we're going to call 1-888-PAIN-FREE. That's 1-888-PAIN-FREE. Now, I have 4 clinics. We actually just opened our 4th clinic right down the road from you on Wisconsin Avenue. So basically what you can do is call that number and receive 2 no-charge laser treatments. Now, I want people to know that it's not just the free laser treatments. When you come in, bring your MRI reports, bring anything you have as far as your medical history, and you'll sit down with a doctor. We'll go over everything. We'll do an exam, we'll do any type of treatment we need to do, and that's all my gift to you on that first visit, no matter which clinic you come to.
Brilliant. Thank you
so much, Dr. M. Scott White, DC. Now listen, stay tuned because coming